Good afternoon. If it's a satellite, it's me. As I told you yesterday, any symposium relies on the support of industrial, of the pharmaceutical industry. And I am happy to greet for the first time in our meetings the company Taurus Pharma. May I introduce to you their solution for enteral nutrition, MediDrink. You will see their advantages and the applications. So, in order to discuss on enteral nutrition, we should look for the conditions where we need to use this. And I will tackle now the oncological aspects, being not able to cover all the fields where we need enteral nutrition. And may I show here some data provided by our sponsor. You see 20% of cancer patients die of malnutrition as a, let's say, associated factor of oncological disease. And here you see the frequency of malnutrition according to the type of tumor. And you see, of course, we have to expect the highest prevalence of malnutrition is in pancreatic cancer, while the urological patients have less frequently malnutrition. And here you see the correlation between the weight loss and the body mass index and survival in patients with cachexia caused by cancer. And you see well that as worse the nutritional status it is, as bad the prognosis is. It means that we should make efforts to improve the energy intake of the patients, because using alimentation with higher energy, we will improve the nutritional status that you see is deteriorated because of the cancer. We can help patients to improve the weight, and is giving also better quality of life. And we also can reduce the rate of complications, and we can adapt the therapy according also to the digestive tolerance. You see here the correlation between high energy intake and the weight loss. And you see that high energy intake is what we expect decreasing the weight loss. So it's improving the nutritional status. Beside this, look how the nutritional status is correlated with the energy intake. You look to normal nutrition state, moderate malnutrition, and severe malnutrition, and this is correlated, you see, with the number of calories the patients take. So the conclusion is we should provide more calories to the oncological patients in need of energy supplementation. But this is not indifferent. What kind of food shall we supply to our patients with cancer, malnutrition, and weight loss? And the problem is that most of us, we rely on carbohydrates. But you see here that tumor cells mainly use carbohydrates instead of other macronutrients in order to meet their energy needs. And there are indirect anti-tumor effects of fat-based nutrition. So it is easy to understand that we should avoid high carbohydrates and low fat. Therefore, we should prefer low carb and high fat nutrition. Here you see also the effect of glucose. Beside of that of glutamine, the glucose deprivation resulting in a significant cancer cell killing, therefore in a better prognosis. That's in an experimental model. Here you see how low carbohydrate diet is inhibiting the tumor growth factors and inducing apoptosis. That's another argument to show that we should avoid high carbohydrate diet in order to provide energy, but to prefer fat energy better. It's the same, the survival is increased in patients following nutrition with low carbohydrate diet. Not only this, but there is an inhibition of glycolysis that is inducing cell death in multi-drug resistant tumor cells. That's another argument to show that carbohydrates in high administration are bad and that low carbohydrate is useful. Another slide is showing here the increased blood glucose levels is increasing the risk of developing malignancy. That's also the risk, and from here I would say also the relapse risk. So we have seen that carbohydrates are not so good, but look, what about the fat? In normal people, high-fat nutrition is absolutely to avoid, but in cancer patients, we prefer to offer high-fat concentration. Look here, it's a combination between low-carb and high-fat nutrition, this helping increasing the body mass, mainly in cachected persons with cancer. Another study showed that a diet with very low carbohydrates in the composition and the better lipid parameters then have a useful effect. Look on body mass index and on other parameters. What about proteins? So I can resume low carbohydrates, high fat intake. What about proteins? Proteins are useful. They are reducing the incidence of postoperative complications, are reducing immunosuppression related to the therapy, is facilitated wound healing, I mean in postoperative patients, preserving the level of albumin, of course, proteins, and in total improve also the immune function. So protein intake is also recommendable in cancer cachexia or malnutrition. High protein intake decreases the rate of complications and hospital readmissions in cancer patients, and high protein intake increases body weight, lean body mass, and albumin level in cancer patients, as you see also in another quite recent study. And then we have also the famous omega-3 intake that's also recommendable in anybody, but mainly in cancer patients. They have anti-inflammatory effects, they increase overall survival, they shift the metabolism toward anabolic metabolism, they decrease the therapy-related immunosuppression, and may fight against cachexia and against weight loss. Look here, a combination of energy, protein, and omega-3 fatty acid-rich nutrition, like those one in MediDrink, is improving the nutritional status, the physical activity, and the quality of life in cancer patients. And our, let's say the host of our symposium is offering to us MediDrink. We have MediDrink Plus and MediDrink Extra. What are the advantages of MediDrink? Let's mention that nutritional status is heavily influenced in post-surgical situations, and MediDrink is a very good enteral supplement. Besides this, patients who need perioperative nutrition are most welcoming the ingestion of such solution. Nutrition may increase the effectiveness of the chemotherapy, anti-tumoral therapy, or targeted therapy. Nutrition during irradiation are decreasing the gastrointestinal adverse effects. This nutrition with MediDrink is improving the cancer-related immunosuppression and enhance immune functions of the body, and also nutrition has no effect on tumor growth, so it has no effect on the development of tumor. And why MediDrink Plus? Because it is a milk-based oral nutrition supplement intended for dietary management of disease-related malnutrition, having a high energy content, high protein content, high omega-3 fatty acid content, low carb, and also containing TGF beta. Look to the advantages. High energy is accelerating the weight gain. High protein is restoring the nutritional status and also the level of albumin, the cerebellum. High omega-3 are blocking cachexia and accelerating weight gain, and the fact that fat is representing almost 2/3 of the total of energy is useful in cancer, but not only in nutrition of IBD, of short bowel syndrome, or also in pulmonary patients. Here you see the composition of MediDrink Plus, accelerating weight gain, restores fat-free mass, blocks cachexia, is beneficial in cancer, is suitable also in diabetic patients having low carb, and leads to good compliance. The energy is 200 calories per 100 milliliters. The proteins are in administration of 8 grams per 100 milliliters, and the low carbohydrate energy is representing only 22%. Again, it's a milk, protein-based, high energy, low volume, and it's presented in several flavors: coffee, strawberry, vanilla, like other nutritional drinks. And beside this, they have also the MediDrink Extra. You see here, the content in proteins is higher, 10 grams, while in Plus is 8 grams. And the omega-3, it's also almost double, 870. So in conclusion, I would like to recommend in those patients requiring enteral nutrition to offer them the MediDrink compounds promoted by Taurus Pharma. Thank you for your attention.